Out of all the sutures we're teaching you, this is probably the hardest to master. This is probably for the most cosmetic closure, as they're running within the dermis deeply, so there's no sutures on the outside at all. So you won't see any of the railroad tracking that you would see from any of the other outside sutures. This is an absorbable suture, and we will start by burying the knot. So I'll go deep in the corner, away from the skin, maybe just the very deepest part of the dermis. And we'll do our instrument tie, and this allows the knot to be buried so we can suture over it. This is important because we don't want knots coming up to the skin. They can stick out. It's called spitting. And patients do not like it when the knots spit. Now the knot is deep, so we're going to go deep and then we're going to come superficial, and that brings us right up to the corner. And this is where we're going to start our subcuticular run. When you start or get close to a corner, definitely recommend smaller bites to start. See, I'm just within the dermis, a horizontal bite. We'll need to advance a little bit on the other side and take another small bite. Again, stay well within the dermis. Now with this stitch, I'm always asked is how much do you advance each time? What I like to do is just see here with my suture where the next bite should be, and that's where I'm going to put it. So in some sense it depends on how much tension there is. On this wound, there's not a lot of tension. Now we're going to start to take regular bites on each side. I'm trying to take the same depth and the same amount of tissue each time. As we begin to advance, keep pulling everything up and keeping tension. Notice I'm not pulling up very tight either. We're just getting the skin to approximate. No buttonholing of the skin. This is just pure horizontal dermis. Wants to come right there. Again, get a good bite of the dermis. Wants to come right there. And just like when we started, as you begin to approach the corner, you want to stop taking such big bites and start going to some smaller bites, because you really want these skin edges to be well approximated at the corner and not create any dog ears. We also want to bury our knot. So if we're going to bury our knot, we have to start thinking about now about getting deep with both of the two ends that are going to get tied. So at this point here, I'm superficial, and I'm going to go superficial on this side and then head deep. That'll get me down to sort of where we started, down deep. And I'm going to take one more bite that's deep. And I'm going to tie that. And that'll help to bury the knot. And now what I'm going to do to help bury the knot as well is to cut the short end here right on the edge of the knot. And I'll take the needle and bury that knot further. So I'm going to pick up here and see where that knot's going, and I can come out through the skin nearby and just simply pull up on this. I can just cut it flush with the skin. That helps to duck our knot from our